Our next guest is Dr. Warren Bleiweiss. Dr. Warren Bleiweiss is board certified in American Academy of Dental Physicians. He's also a pain management physician out of New Jersey. Hi, Dr. Bleiweiss. How are you doing today?
Good, good. Hi, AJ.
Dr. Bleiweiss, you are working in one of the states that are considered as a hot zone and have a lot of COVID-19 in your states. Now, what is some of the advice you're giving your patients?
Okay, so obviously the obvious advice is isolation, which we can't keep up forever. So I feel that the most important thing, and this is what I tell my patients, is to boost the immune system and keep yourself healthy. Because after all, the immune system is our natural defense against pathogens and against viruses. And up until modern times, it was the only thing that the human race had to protect ourselves from the viruses such as the COVID virus. And in addition to boosting the immune system, I like supplements and vitamins that also they boost the immune system, but they also inhibit the virus ability to infect and to be virulent. And they also reduce the negative consequences of the virus that could damage organs, such as the cytokine storm. So a lot of these supplements and vitamins are very well known and common, and I've been recommending them for years to my patients. For example, vitamin D. Vitamin D accomplishes all of the things that I just mentioned. It's an potent immune booster. It reduces the ability of the virus to infect. It actually occupies the ACE2 receptor of the cell, which is where the virus attaches, and particularly in the lung. So it reduces the ability of the virus to infect, and it also reduces the output of inflammatory cytokines. So it accomplishes all three of the things that I mentioned. Vitamin C is another one. It's a powerful immune booster. It's an antioxidant, and reactive oxidant species are very a big part of the damage that takes place in the lungs and other organs. It has antiviral properties, and it has anti-inflammatory properties. And then there's zinc, which is a very potent antiviral. And then I recommend other treatments such as melatonin, which has a lot of anti-inflammatory properties and antiviral properties, and ozone, which is extremely powerful treatment for boosting the immune system, which I've used in my practice for many years. And it also is a powerful antiviral agent. So I've been using ozone for many years to treat disc herniations. It's very safe and very effective. In fact, it's just as effective as surgery with almost no harmful side effects. Actually, it has no harmful side effects.
And especially over the past couple of days, we've seen physicians out of Brazil, Spain, as well as Italy. They're starting to use that to treat their patients with COVID-19 in the emergency room as well as the ICU settings. So it's getting a lot of positive attention, and that is hopefully something that would come to the United States as a standard of care in using the against using COVID-19 virus.
Correct, yes. And it has a very unique quality because it lyses the outer envelope of the virus. And once the outer envelope of the virus is lysed, it's basically destroyed. The virus can't attach, it can't be infective, and and it also exposes other parts of the virus that normally wouldn't be exposed to the immune system.
Well,
So, great technique.
well, thank you so much. Any other advice for people out there, Warren?
The other advice that I would give is we have to do something on an ongoing basis to keep our body strong, keep our immune system strong, keep ourselves healthy, and protect ourselves from pandemics such as this. I mean, 6 months ago, or even 3 months ago, none of us were expecting this. It came out of left field and it swept through the world, and it's this terrible pandemic, and it should teach us that we really have to do things that will protect us from this thing in the future, this sort of thing. And unfortunately, in the modern society, we're exposed to a lot of things that cause chronic inflammation. And we have so many chronic inflammatory diseases in our society, such as anything with an itis. I mean, I could sit here for an hour and list all the itises, like cystitis, sinusitis, arthritis. Inflammatory bowel disease is another one, not an itis, but it's inflammatory. We even now know that diabetes type 2 has an inflammatory component, and probably osteoporosis. So we have to take steps to reduce inflammation in our bodies, and it's beyond the scope of this interview to get too deeply into it, but I would suggest reading some books by Stephen Gundry. One is called The Longevity Paradox, and it talks about how gut permeability and lectins and glutens are responsible for a lot of inflammation. There's also a lot online that you could research on that. And obesity is another big thing. Obesity leads to chronic inflammation, as well as a host of other health issues. We know that obese fat has a higher level of more Tregs, less Treg cells, more T cells and less Treg cells, and less type 2 macrophage cells, which those cells are anti-inflammatory cells. So lean fat has an anti-inflammatory profile, and obese fat has an inflammatory profile and secretes inflammatory compounds. And there's also stress. Stress is a really big problem in modern society and leads to inflammation and a host of other negative health problems. So anything we could do to reduce stress, such as meditation or yoga or Tai Chi, and reduce the incidence of obesity and reduce the incidence of inflammation, is very important in preventing these things. And this has to be done on an ongoing basis. So many things, it's like a New Year's resolution. People, make a resolution, oh, I'm going to do this, I'm going to meditate, I'm going to exercise, I'm going to lose weight, I'm going to eat organic foods, I'm going to do X, Y, Z, and then we forget. But this
we've done every day.
Pandemic is a wake-up call, and we should be doing this stuff on an ongoing basis.
Yes, it's got to be done every day, not like if you exercise, it's got to be done every day. You got to take care of the machine every day. Well, thank you so much for joining us, Warren, and I wish you health and happiness. We'd love to have you back on this program so we can talk, we can get deeper on some of the subjects that you didn't get opportunity to talk about.
Oh, yes. Okay, I'd be happy to, and thank you very much.
Take care.